Psoriasis is a chronic skin condition. It is not contagious. This means you cannot catch it from someone else, nor can you pass it on through physical contact. Despite this, many people with psoriasis face social stigma and misunderstanding. It happens when the immune system malfunctions. The immune system, which normally protects the body from infections, mistakenly attacks healthy skin cells. This malfunction causes skin cells to grow too quickly. Instead of the usual cycle, where skin cells grow and shed over a month, the process speeds up dramatically. Normally, skin cells grow and shed over a month. This balanced cycle ensures that old skin cells are replaced by new ones in a controlled manner. With psoriasis, this process happens in just a few days. The rapid turnover doesn't allow the skin cells to shed properly. The rapid growth creates a buildup of skin cells. These cells accumulate on the surface of the skin, forming thick, scaly patches. This buildup forms scales and itchy, dry patches. These patches can be uncomfortable and sometimes painful, leading to a constant urge to scratch. These patches are often red or inflamed. The inflammation is a result of the immune system's attack on the skin cells. Psoriasis is not just a cosmetic issue. It can cause significant emotional distress and impact a person's self-esteem and mental health. It is a serious medical condition that can impact quality of life. Daily activities can become challenging, and the constant discomfort can be overwhelming. Psoriasis can occur at any age. It affects both children and adults, and its onset can be unpredictable. It most commonly appears between the ages of 15 and 35. This is a critical period in life, often affecting social interactions and self-image. It can also affect people later in life. Older adults may face additional challenges due to other health conditions. There is no cure for psoriasis. However, ongoing research continues to provide hope for better treatments and understanding of the condition. However, many treatments can manage the symptoms. These include topical treatments, light therapy, and systemic medications, which can help reduce the severity and frequency of flare-ups. Psoriasis is a common condition that affects the skin, causing red, scaly patches that can be itchy and painful. It is a chronic disease that can flare up at any time, often triggered by stress, infections, or even certain medications. It affects millions of people worldwide, cutting across all races, genders, and age groups. The prevalence of psoriasis varies from country to country, but it is estimated that around 2 to 3% of the global population is affected by this condition. In the United States alone, over 8 million people have psoriasis. This means that approximately 2.2% of the American population is living with this chronic skin condition. This makes it one of the most common autoimmune diseases in the country. Autoimmune diseases occur when the body's immune system mistakenly attacks healthy cells, and psoriasis is a prime example of this malfunction. The impact of psoriasis goes beyond the physical symptoms. The visible nature of the disease can lead to significant emotional distress, affecting a person's self-esteem and confidence. It can significantly impact a person's emotional well-being and quality of life. Many individuals with psoriasis report feelings of depression and anxiety, which can be exacerbated by the social stigma associated with the condition. The visible nature of psoriasis often leads to self-consciousness and embarrassment. People may go to great lengths to cover up their skin, avoiding situations where their condition might be noticed. This can impact social interactions and relationships. The fear of judgment or misunderstanding can lead to social isolation, making it difficult for individuals to form and maintain personal connections. Many people with psoriasis experience itching and pain. These symptoms can be persistent and severe, requiring ongoing treatment and management to alleviate discomfort. This can disrupt sleep and make daily activities difficult. The constant need to manage symptoms can be exhausting, affecting a person's ability to work, study, and engage in everyday tasks. The emotional and physical toll of psoriasis can contribute to anxiety and depression. Seeking support from mental health professionals can be crucial in managing the psychological impact of the disease. It's important to remember that psoriasis is not a sign of poor hygiene. It is a complex autoimmune condition that requires medical attention and understanding. Raising awareness and educating others about psoriasis can help reduce stigma and support those affected by this challenging condition. Psoriasis presents with a variety of symptoms. The most common symptom is patches of thick, red skin. These patches are often covered in silvery white scales. These patches can appear anywhere on the body. Commonly affected areas include the scalp, elbows, knees, and lower back. However, psoriasis can develop on the face, palms, and soles of the feet. It can even affect the nails, genitals, and inside of the mouth. The severity of symptoms varies greatly from person to person. Some people experience mild itching and small, localized patches. Others deal with severe itching, pain, and widespread patches covering large areas of their body. Diagnosing psoriasis typically involves a physical examination. The dermatologist will carefully inspect the skin, looking for specific signs and symptoms that are characteristic of psoriasis. This includes red patches of skin covered with thick silvery scales, dry and cracked skin that may bleed, and itching or burning sensations. A dermatologist will examine the affected skin. They will look for the distinctive features of psoriasis, such as the location and appearance of the lesions. Psoriasis can appear on various parts of the body, including the scalp, elbows, knees, and lower back. They will ask about medical history and any family history of psoriasis. This information is crucial because psoriasis can be hereditary. Understanding the patient's medical background helps in making an accurate diagnosis and ruling out other conditions. In some cases, a small skin sample may be taken. This procedure is known as a skin biopsy. The sample is then sent to a laboratory for further examination. This is called a biopsy. The biopsy can provide more detailed information about the skin cells and help confirm the diagnosis of psoriasis. A biopsy helps rule out other skin conditions. By examining the skin sample under a microscope, pathologists can identify the specific characteristics of psoriasis and differentiate it from other skin disorders. These conditions might include eczema, which often presents with red, inflamed skin and intense itching; ringworm, which is a fungal infection that causes ring-shaped rashes; or dermatitis, which can cause swollen, red, and itchy skin. There is no single test to diagnose psoriasis. The process relies on a combination of clinical evaluation and sometimes a biopsy. The dermatologist's expertise and experience play a significant role in making an accurate diagnosis. The process relies on a combination of clinical evaluation and sometimes a biopsy. The dermatologist will review the biopsy results and discuss the findings with the patient, explaining the diagnosis and the next steps. Early diagnosis and treatment are crucial in managing psoriasis. Effective treatment can help control the symptoms and improve the quality of life for those affected by this chronic condition. If you suspect you might have psoriasis, it's essential to consult a dermatologist for an accurate diagnosis and to discuss treatment options. Early intervention can make a significant difference in managing the condition and preventing complications. Section 5. Treatment options for managing psoriasis. So, there is no one-size-fits-all treatment for psoriasis. Treatment plans are tailored to each individual, They are based on the type, severity, and location of psoriasis. Plus, they also consider the patient's overall health and preferences. Now, treatment options for psoriasis fall into three main categories. These are topical treatments, light therapy, and systemic medications. Topical treatments are applied directly to the skin. These include creams, ointments, lotions, and shampoos. Light therapy involves exposing the skin to controlled amounts of ultraviolet light. Systemic medications work throughout the body. They are taken orally or by injection. Section 6. Living with psoriasis, lifestyle and support. Living with psoriasis often involves making lifestyle modifications. These modifications can help manage symptoms and improve quality of life. Avoiding triggers is crucial. Triggers are things that worsen psoriasis symptoms. Common triggers include stress, infections, certain medications, and skin injuries. Identifying and avoiding personal triggers can make a significant difference in managing psoriasis. Maintaining good skincare is essential. This includes keeping the skin moisturized. It also means using gentle, fragrance-free products. Eating a healthy diet, exercising regularly, and getting enough sleep can also help manage psoriasis. Section 7. Raising awareness, campaigns, and their importance. Raising awareness about psoriasis is vital. It helps dispel myths and misconceptions surrounding the condition. It also encourages early diagnosis and treatment. Several organizations, including the National Psoriasis Foundation, work tirelessly to increase awareness. They provide valuable resources and support to individuals living with psoriasis. Psoriasis Awareness Month, observed annually in August, serves as a dedicated period to educate the public about psoriasis. Campaigns during this month focus on educating the public. They also aim to reduce stigma and empower individuals with psoriasis to seek help. Section 8. Real-life stories. Living with psoriasis. Real-life stories of individuals living with psoriasis can be incredibly impactful. They offer a personal perspective on the challenges and triumphs of managing the condition. These stories can help others feel less alone. They can also inspire hope and resilience. Sharing experiences can also reduce stigma. People with psoriasis may feel more comfortable talking about their condition. Hearing personal accounts can have a powerful effect. They can help others better understand the reality of living with psoriasis. Section 9. Conclusion. Seeking help and information. Psoriasis is a chronic skin condition. It can have a significant impact on a person's life. While there is no cure, many treatments can effectively manage symptoms. Early diagnosis and treatment are essential for the best outcomes. If you suspect you may have psoriasis, consult a dermatologist. They can provide a proper diagnosis and discuss treatment options. Remember, you are not alone. Support and resources are available to help you navigate the challenges of living with psoriasis.